Welcome to the deep dive. Today we're getting into something really fundamental in healthcare.
Yeah, we're looking at certified nursing assistants, CNAs, what they do, what they don't do.
Exactly. We've looked at training materials, job descriptions, state rules, all sorts of things
Mm-hmm.
to give you, our listeners, a clear and quick understanding of this vital role.
It's so important, isn't it? Knowing the scope of practice for CNAs. It's about teamwork, sure, but mostly patient safety.
Absolutely.
Hmm.
So where should we start? Maybe hospitals,
Good place to start. Okay, so in a hospital, CNAs are really focused on basic patient care.
like personal hygiene stuff,
Right. Bed baths, helping with oral care, and they're constantly taking and reporting vital signs. That's crucial.
and helping patients move.
Yes, turning them in bed, transferring them to a chair, maybe helping them walk a bit, plus keeping supplies stocked, equipment clean, that kind of hands-on support.
Got it. So they're like the eyes, ears, and hands for the nurses in many ways.
Pretty much, yeah.
Mhm.
Providing comfort, gathering that essential data.
Okay, how does that shift then, say, in a nursing home or a long-term care setting?
Well, in long-term care, the focus, it kind of broadens. It includes more of those activities of daily living or
Yeah,
ADLs. So yeah, hygiene is still there, but CNAs often spend a lot more time helping residents get dressed, use the toilet, eat their meals.
makes sense, given the residents might need more ongoing support.
Exactly. And because mobility can be limited for many residents, watching their skin, preventing pressure ulcers, that's a really big deal. Turning and repositioning.
That's a huge responsibility.
It is. And there's also, a social component,
Mhm.
companionship, engaging with residents, sometimes facilitating family communication, but always under the nurse's guidance.
So a bit more holistic in long-term care, physical and social support.
You could say that, yeah.
What about home care then? Must be quite different working in someone's house.
Oh, definitely. Adaptability is key there. Every home environment is unique.
So what might they do?
Tasks can vary a lot. Might include some light housekeeping, maybe preparing meals, sometimes even grocery shopping, depending on the plan.
And it's usually one-on-one, isn't it?
Often, yes. So that close observation, the companionship aspect, becomes even more central.
Mm.
And they have to be sharp about spotting potential safety issues in the home, too, reporting hazards.
Okay, so we've covered a lot of what CNAs do.
Yeah.
Let's flip it. What are the definite no-goes, the limitations?
Right, this is crucial. There are firm lines. CNAs cannot administer medications, period.
Not even if a nurse prepares it.
Well, the only sort of exception might be simply handing a patient a little cup with pills already in it, if facility policy even allows that. But no calculating doses, no injections, nothing like that.
Okay, no meds. What else?
No invasive procedures. So starting IVs, giving injections, putting in catheters, absolutely not.
That's nurse territory.
Or doctor territory, yes. And importantly, CNAs don't do independent clinical assessments. They gather data, like vitals, but they don't interpret it to make a diagnosis or create the nursing care plan.
Right. Diagnosis and prescribing are way outside their scope. That's for RNs, LPNs, MDs.
Precisely.
So how does a CNA make sure they don't accidentally, cross those lines in a busy shift?
Communication is everything. Always, always clarify orders if unsure. Talk to the RN. Ask for written instructions if needed.
Use the chain of command.
Absolutely.
Okay.
Report concerns to the charge nurse, know your facility's policies inside out, and be aware of your state's specific rules, the Nurse Practice Act.
And document everything.
Meticulously. If you didn't chart it, you didn't do it, but also it clarifies what care was provided and by whom.
Okay, good advice. Let's tackle a couple of common myths then. I've heard people think CNAs can give shots if a nurse watches.
Nope. Absolutely false. Doesn't matter who's watching. Giving injections requires a nursing license, an RN or LPN. It's about patient safety.
Clear enough. What about feeding? Is it just spooning food into someone's mouth?
Not at all. It's much more complex. You're monitoring how much they eat, checking for dietary restrictions, and critically, watching for any difficulty swallowing.
Just
Exactly. That needs immediate reporting to the nurse. It's observation, not just mechanics.
And the idea that CNA work is just tasks. No thinking involved.
Oh, that's a big misconception. CNAs spend the most time directly with patients. They are often the very first ones to notice subtle changes, like a small red spot on the skin, a change in mood, a new complaint of pain. Recognizing that something is different and reporting it. That takes sharp observation and critical thinking. It's vital.
That really reframes the role, doesn't it?
It should. They are essential members of the care team.
Okay, quick scenario then. A CNA is asked, maybe in an emergency, to start an IV. What do they do?
Simple. Polite but firm refusal. I'm sorry, starting an IV is outside my scope of practice as a CNA. We need to get a nurse to do this.
And then tell the nurse immediately.
Immediately inform the patient's nurse about the request and why the IV might be needed. It's about safety and following protocols.
Okay, so let's wrap this deep dive up. What are the key things listeners should take away about the CNA role?
I'd say three things. First, really understand your specific duties in your work setting, hospital, LTC, home care. They differ.
Right.
Second, be crystal clear on the limits. Know what you absolutely cannot do, your scope of practice.
And third,
Never hesitate to ask. If you're unsure about anything, ask the RN. Seek clarification, always.
it really boils down to knowing your role, knowing the boundaries, and communicating clearly.
Exactly. It's not just about rules for rules' sake. It's about making sure patients are safe and get the best care possible from the whole team working together effectively.
A really crucial point. Understanding everyone's role helps the whole system work better for the patient. Thanks, that was a really insightful deep dive.
My pleasure. It's an important topic.